So our next presenter is going to be Angela O'Byrne and Brad Calloway from Keys Behavioral Health. Angela is actually in South Sudan right now. She just traveled there a few days ago, so she's up past bedtime, and she has warned me that her Wi-Fi connection is not very stable there, but we're going to try to bring her on, and we're going to bring on Brad as well. And this is really a great example of a, hello, Angela. This is a great example of a community-driven opportunity zone investment. And these folks here and their fund recently won a OZ Pitch Fest competition that took place in the Acadiana region of Louisiana, which my co-founder Ashley Tyson was one of the panelists on. And Rachel Riley, our keynote speaker this morning, was also one of the panelists on that Pitch Fest. So we're very pleased to have them here with us today, Angela O'Byrne and Brad Calloway.
Yeah, can you hear me?
Yes.
At all?
Yes.
Okay.
Yes, we can.
My connection is extremely unstable. It's coming and going, actually. So I'm gonna, with that, just turn it over to Brad and let him share the screen and do all the talking, and I'll just listen and answer Q&A if the questions are ones that I can answer. Otherwise, Brad will answer.
Awesome. Thank you.
Sorry about that.
No, not a problem at all. Thank you for
Beautiful downtown Juba, South Sudan.
Well, yeah, we're coming to you internationally today on this pitch day event. So, Brad, I see your screen. It looks good.
Oh, good.
I think we're good to go.
Well, the real key here is, I was glad you had your poll earlier where you asked the motivation, whether it was social or financial or tax driven. We have for you really what is a very social project that also provides tax impact as well as a financial return. We're going to be creating and expanding mental health services, creating new jobs, while also restoring historic properties in a neighborhood district in New Iberia, Louisiana. We're going to utilize new market tax credits and historic tax credits, and of course the Opportunity Zone funds. In doing so, Keys Behavioral Health Center will go from being solely an outpatient service provider to being able to provide inpatient services, outpatient services, as well as transitional housing for the patients. We have here our table of contents and the development summary and analysis. The key here is it's a $17 million project in South Louisiana. We'll be utilizing the tax credits and Opportunity Zone funds, the 40 residential patient beds for inpatient. We'll have 9,000 square feet of outpatient clinic space and a total of 29 housing units available for split between men and women. Those units are for the people who have gone through inpatient treatment but are not ready to live on their own yet. And that way they can be close to being able to maintain the care and attention they need in order to finish their recovery. Our total budget you'll see is $17 million. One thing I would point out to you is between the new market tax credit equity and state historic tax credit equity, there's $5 million worth of proceeds we anticipate coming into the project. That's $5 million of funds that will not have to be repaid on the back end. That is equity proceeds where people are paying the funds in order to receive tax credit benefits. This is our first year of full operation data. You'll note that in the first year after debt service, or actually before debt service, the project will generate about $775,000 worth of income. The important key that I will point out to you here is this is year one. We have in our 10-year pro forma and projections, by the time you get into years 7, 8, and 9, you're over $2 million a year in gross returns before the debt service. And you'll note here that we are building in a 5% preferred return for ozone investors, assuming a $5 million investment, that's why the 250. And then looking at a 50% distribution share that would go between the ozone investor with the balance either being distributed to existing members or being retained by the company, obviously, for operations. Over a 10-year time frame, you're looking at a cash-on-cash return. Whoops, I hit the wrong button, my apologies. You're looking at a cash-on-cash return of about 12.4% average over those 10 years. You'll note year one, I'm showing a negative 5 million. That's the investment coming in. And of course, that would also be the construction time frame period. But after that, you see the returns continue to ramp up. By the time you get to year 9 of operations, you're looking at a 15% cash on cash return, assuming that $5 million. We feel that's a very competitive return, particularly for a social impact and the major impact that it can have on lives. We are in a low-income census tract in Southeast Louisiana. Some of the initial design plans, though, the 4 dots you see are the 4 historic buildings that will be renovated. One for outpatient, one for inpatient, and then the 2 residential transition housing pieces. Aerial overview of the same. And then the floor plans for part of the residential. This is the one of the patient centers. Again, the transitional housing for the men, and then a street view of the courtyard, et cetera. Perez Architects is the lead developer and co-sponsor of this, along with Dr. Joseph Wilson. We're also working with Amcrest Financial related to the new market tax credit allocation to help us in placing that and finding the investors. We have Coach Rose, which is a tax credit firm based out of Houston, Dallas, and New Orleans that specializes in opportunity zone credit, as well as state and federal historic and new market credits. And then, of course, Novogradac and Company, who is one of the premier CPA firms that specializes in tax credits, opportunity zones, and social impacts. I mentioned Dr. Joseph Wilson. He has over 30 years of healthcare experience in doing social work and mental health and addiction recovery, along with Dr. Victor Jackson. Corrine Stosan will be the clinic administrator and operations manager, has extensive experience in psychology and in clinical services, along with Bryant Blanchard. And then, of course, you have Angela, who is the sole owner and principal of Perez Architects and is responsible for part of the design. Angela, along with Bernard Wilson and Dr. Joseph Wilson, all serve on the board of Keys Financial, and Angela has been very active in their operations and services over the last 10 years. The clinic originally started, this is a little bit of history, I won't go too deep. The real key here is they have been in business and operating as Keys Financial for over 15 years with Dr. Wilson as the principal there, highly involved. They have a tremendous reputation and a strong effectiveness for treating addiction services and also in making each of their clients, feel special and helping them overcome their struggles and tragedies. Most of their clientele at this point is actually chemical addiction and alcohol addiction. They're seeing an increase in drug addiction and also alcohol addiction. And of course, with the pandemic, I don't have to tell you, there are a lot more people who are unfortunately taking their wares to alcohol and drugs. Addiction in Louisiana is up over 10% and it continues to grow and expand as it is nationwide. You'll see in this graph, just the level of drug deaths have increased 3 times the number in the past 20 years. Men are more active and more likely for death than women. The rates of death and the ages of death are continuing to get to lower and lower ages. I mean, we have a real problem, not only in Louisiana, but throughout the entire nation. And in Louisiana, we face a dire need for more bed and more treatment. Because of Dr. Wilson's experience, he has a tremendous referral network that is used in terms of the Louisiana Department of Children and Family Services, the local parishes. We don't have counties, we have parishes in Louisiana. And the judges and physicians all refer to Dr. Wilson, and he utilizes those referral sources as well as word of mouth. The typical profile: 90% of the patients who come through are low-income residents and drug addicts. What this really means is there's not a lot of private insurance care that goes towards this. There's a lot of Medicaid and government assistance funds that come through. That Medicaid money is fairly strong related to the mental health side. And towards that end, it does provide a fairly strong source of continuing revenue that will be sustained. You'll note that last graphic under the profile, 50% of young women with children are now being part of the clientele. And this is something new that has been happening, and obviously is something that needs to be addressed in order to try to break a cycle of drug addiction or addiction problems. Angela, like I said, is the primary investor, or the primary developer and co-sponsor along with Dr. Joseph Wilson. We feel that given the social impact, being able to return a solid 12% cash on cash return on an annual basis will be something that is appealing and can be very successful. We do envision at the end of 10 years that the properties that are involved and the cash flows of the clinic will be such that you would be able to cash out on a refinancing in order to eliminate that opportunity zone money that will be coming into the project on the front end. So we feel very comfortable with the return of the investment as well as an overall 12% plus cash on cash return. Any questions?
Well, that's great, Brad. Thanks for being with us today and presenting. I don't know if I see any questions here. Let me see. I don't think we have any specific questions that came in. I'd like to just ask you a question though. The Keys Behavioral Health Center. Maybe you could tell us a little bit more about the history of it and when you got started. And is it just the one location, or are there multiple locations throughout the region?
It is currently a single location. Dr. Wilson actually started the clinic with some partners back in 2006 and ultimately bought out some of his partners. He has only been operating as an outpatient facility, which has created a problem because many of his patients need inpatient care. And he has to wait oftentimes weeks and months in order to get them admitted into facilities that may be anywhere from 100 to 200 miles away from where they're actually living. His particular clinic throughout the pandemic has maintained its services. We've all heard of video medicine now, where we didn't have it before, and that certainly can apply, and he has been utilizing that as well throughout the pandemic. The key here is he services and will be able to provide inpatient hospital services from people from Lafayette, Louisiana, from Baton Rouge, from New Orleans, from all of what we call the Saint parishes, St. Mary's, St. Tammany. I mean, there are multiple parishes that he services from this one clinic. He's about 25 miles from Lafayette, which is a population of 150 to 200,000. He does a lot of offshore chemical addiction treatments for employees of offshore drilling platforms, as well as his continuing practice with alcohol and other types of drug addiction.
Good. I got a comment in here from Ian Ross from OpSites. He just wanted to say hat tip to Brad and Angela and the work that they are doing. I know that many Opportunity Zone projects carry a measurable social impact, but I always appreciate the ones I see on OpSites and elsewhere that start from that point of view. So a little applause there from Ian, and I'll echo that as well. We got one final question here. Oh, we got two final questions here. Two more questions here for you, Brad, and then I'll cut you loose. Dr. Devin asks, are investors investing in the clinic as well as the commercial real estate?
We anticipate that they would be investors in the clinic to be able to return. The return will be coming from the clinic, not the pure real estate itself.
All right, good answer there. And then finally, two more questions. They keep popping up now. What's the minimum investment?
I would probably need to defer that to Angela to answer that. I mean, we are looking to try to raise a total of about $5 million to do this project. And toward that end, I would say that we'd be willing to accept it as small as possible to try to get us to the $5 million number.
Good. Angela, do you have anything more to add on that, what the minimum investment might be? Oh, she just chatted me. She says the minimum investment is currently $50,000.
Okay.
That's the minimum investment that she's set. And then will the project be impacted by historic building requirements?
It will, but that does not represent a problem. I personally have been involved in over 80 historic tax credit renovation projects throughout the country in different locations. Angela, as an architect, is quite the expert at architectural requirements to meet the historic renovations. One of the keys here is our primary historic funding is coming from the state tax credit funds, and the state tax credit law is not federal. We do have some small portion that will come from federal, but compliance with the state rules and the federal rules for the rehabilitation requirements is something that Angela has already worked through with her architectural staff, and they're very comfortable with.
Good. Where can investors go to learn more? Is it best that they reach out to Angela and Joseph via email? Is that the best way?
I think the best way is to reach out to Angela. Dr. Wilson is often very difficult because he's treating patients, which is a good thing. But if you reach out to Angela, Angela can have them either contact me for some information or some of the other staff people who are also working on the project with her.
Okay, good. And I just posted Angela's email address in the chat. If you just want to grab it, you can copy and paste it and say, hey, send me more info, Angela, and she'll get in touch with you shortly. One final question. What capital structure are you looking for?
Well, with the historic tax credits, we're envisioning that the tax credits will be generated at a landlord level and that the operating business would be an LLC where we would be able to flow through cash flows as a partnership type structure.
Awesome. Well, Brad and Angela, again, my hats are off to you, and thank you for joining us today. That's all the questions that we had for you. But if you're out there, if you're watching and you do have more questions about Keys Behavioral Health and their project, please do reach out to Angela. I just put her email address in the chat pane there. So I'm going to move on now to my next presenter. Unless, Brad, do you have any parting words for us before I let you go?
Thank you very much for the time and for the attention.
Absolutely. Well, thank you, Brad, and thank you, Angela, as well. And good luck there in South Sudan. I hope your Wi-Fi gets better. All right. Thank you both.
Thank you.